Welcome. Great to have you here. This is a unique moment, a moment that unites all of us. We all face anxiety and loss. We all see broken systems. We all experience the impact of the climate crisis. This is a unique moment. This is a turning point if we choose to make it one. This is a moment to reflect, to learn, to share, and to co-create. And I invite you to contribute. I ask you to contribute. I ask you to partner to fix broken systems. I ask you to join the movement so everyone can step into their change-making power. I ask you to nominate the next generation of changemakers. And I ask you to share your wisdom, your knowledge, your expertise. And I ask you to donate to support changemakers. This is our moment to fix the world. This is our moment to contribute. Today is the day, and you are the one.
So, good morning and welcome to our session, Digitalizing Service Delivery. What have we learned so far? Today, we're going to talk about how can we actually, in times of the COVID-19 pandemic, cater to the needs of vulnerable parts of our communities? What can we do in spite of the fact that a lot of the things we do now have to move to the digital, as this conference, for instance? And I have three fantastic guests for today, which will share their insights, and we will have a conversation with you, the audience, and them. Welcome Joost from the Netherlands, who's a founder of Healthy Entrepreneurs. It's an organization that's actually working on improving the supply chain of dysfunctional healthcare systems in countries like Rwanda, Burundi, Haiti, and they use mostly micro entrepreneurs for last mile delivery of healthcare products, so that really all parts of the population receive the healthcare products they need. Welcome, Joost. And I also welcome Hugo from Portugal, who is the founder of Speak, an organization that creates community and learning spaces for migrants, refugees, and locals. And I'm also looking forward to your insights on the topic. Welcome, Hugo. And we have Walburga from Austria, founder of the organization Tempo, which makes sure that especially people with disabilities and learning difficulties have a say and become co-creators of the spaces and structures that affect them, for instance, at work or in healthcare institutions. So also warm welcome to you, Walburga.
Hello.
My name is Michael. I'm with Ashoka Austria. I work there in the field of children and youth, and especially we work a lot also with disadvantaged youth. So I'm also looking forward to share my insights. Also, I want to say welcome to Loic, who quickly will introduce himself and what his role is today. Loic.
Thank you, Michael. Good morning, everyone. My name is Loic. I also work for Ashoka in Austria, and I mainly support our fellows to scale their impact in new context through a program we call Impact Transfer. I will be facilitating or having a look at the chat and ensuring that your questions, your comments are picked up and integrated into the panel discussion. So please use the chat, share your comments, suggestions, and questions. Back to you, Michael.
Thanks, Loic. So we want to have a lively discussion with you, and for that, I'm going to quickly share my screen. Of course, we want to capture what's going on in this conversation. So the flow is pretty simple for the next hour. So first we'll have Joost present, then Walburga tell us about her insights, and then we will have Hugo presenting his insights. And of course, there should be an element of co-creation where we actually not only harvest the insights we gather from this conversation, but also ideas of moving forward. Loic will be so great as to capture parts, not everything, of course, but parts of our conversation on this Miro board. There are three things we want to focus on in this conversation. First of all, of course, core insights from our three guests. So what are the things that we learned today? The second is barriers and enablers, which is really about what is enabling the work we do with vulnerable groups for our communities through digital means, and what are the barriers in working with them in times like these. And of course, it's important ideas moving forward. And I also invite you, if you through the conversation have ideas, want to share an insight, want to share an idea, please do it in the chat. We try to collect it and at the end incorporate it into this nice board. All right, so that's the flow for the day. And for those who have already joined other sessions, of course, there is the compulsory Mentimeter at the beginning. To gather an idea what the participants think regarding the topic of our conversation today. I'm going to share it in the chat on Swapcard. So please just click on the link. And when you click on the link, you will be prompted by a slider question. So there are three statements where I ask you to, if you strongly disagree or strongly agree. It's in my field of work, the COVID-19 pandemic has led to, and then there are three statements. And now I invite you to fill in that question. Loic, also let me know if the link works. And I will actually share my screen so that we can see what people think regarding these questions. So we wait a little bit so that everybody has time to answer this question. Okay, that's interesting. Let's just wait a little bit for the other incoming answers. And also I invite Joost, Hugo, and Bob Burger. I'm curious, what are your thoughts on this? Okay, as we see, there is obviously agreement that digitalization has been happening for disadvantaged groups. So the services are increasingly digitalized. Also, creativity obviously has improved, and obviously it has not necessarily led to a worsening of the delivery of services for disadvantaged groups. So it's a quite interesting result. And with that in mind, I want to invite our first guest, Joost, to share his insights and opinions on that. Joost, the floor is yours.
Oh, thank you very much, first of all. Pleasure being here. Good morning to all, wherever you are. I'm calling in from Kampala, Uganda, where I'm currently based, managing part of our operation we have in Uganda, next to other countries. I've prepared a small presentation I will share with you to give you a slightly better insight in the type of work we are having at the moment. Now, of course, you would like to see my screen and it doesn't work. Let me see if this works. Please confirm you see my screen now.
We see your screen, yeah.
Okay, very good. Well, the organization is called Healthy Entrepreneurs, and I'm founder. I have a master in business administration, and I would like to tell you some of my story. My first job after I finished the master of business administration was selling canned meat, spam. I've been traveling all over the world to sell those canned meat products. I've been everywhere in more than 150 countries around the world. But then one day I got into a city, or a village. It was like an hour walking distance or a driving distance from Bujumbura, the capital of Burundi, where I found a community. I was completely amazed. And while talking with those people, I realized that those people are dying today due to infectious diseases, diarrhea, typhus, simple diseases that can be cured and are actually supposed to be cured, but in practice are not happening. And I felt like, this is amazing. I'm able to sell spam everywhere. I'm able to distribute it all around the globe. And those communities are not having even access to basic health commodities. I thought it was only this community, but I later learned that there is around 600 million people living in sub-Saharan Africa today that are not having access to healthcare, proper basic healthcare. And that's why I, 8 years ago, founded an organization called Healthy Entrepreneurs with the aim to make sure that for last mile service delivery is properly organized. We are having products available people can acquire. We have information available people need to actually live a healthy life. And that's where it all started. So we are offering a model where we are empowering community health workers and we make them community health entrepreneurs, serving their local community with health education, consultation or counseling, and an option to acquire products that are regularly supplied. So our entrepreneur makes his or her own investment. And in return of the investment, they get training. In return of the investment, they get a smartphone, including a solar panel with 2 apps on it. And they get access to credits that of products supplied on credits, enabling them to serve their community with all the basic needs they have. We have a sophisticated but very straightforward supply chain system, enabling them to supply them every 2 weeks with all the products they need. Technology plays a key role, and that's what it's all about today. We are using apps in local language, including health educational movies, including digital algorithms, providing support in decision taking, providing support to have access to the right information needed for information people deserve. We are having a solution where we are able to receive orders through our app, where payments can be made using mobile money or other means, even cash. And so people know when they can calculate what they need, they can send the orders automated into our systems, enabling us in a very efficient and low cost structure, supplying them every 2 weeks, making sure that people are having access to products. We have actually expanded our services, where as from the very beginning, we were only providing access to products. Over time, we started also providing education, and now we are also doing a lot of consultations on the spot, training our entrepreneurs or health professionals in the village having access to a doctor. Because what they do, they measure blood pressure, they measure blood sugar, they measure malaria, and they register all those information into their phone. The information from the phone, regularly measured, is shared with our doctor, who is at a distance talking with the patients, monitoring the progress of patients, both for infectious diseases which need a one-off treatment versus also people who are on long-term treatment for diabetes or hypertension. And this is all happening in only the remote and hard-to-reach areas. We make sure that our entrepreneur gets a prescription from the doctor at a distance and provides the medicines on the doorstep of our patients. So it's a solution where people living in hard-to-reach and remote areas are having access to health education and consultation, actually services they are in need of and they haven't been provided for long. We have our team, which is just an example made during COVID, because also we are in COVID response, that are operating from our office. And they are able to serve the whole nation of Uganda with more than 4,000 points into Uganda where people can call from to acquire information. We have nurses, we have clinical officers, we have medical doctors who are providing upon need the right feedback and support. And what we also offer to our entrepreneurs to keep and make them learning is not only by having them supplied every 2 weeks, including offering regular training face-to-face, but we have IVR or interactive voice recognition and response trainings where they can train and they can collect additional information about how to provide more information and services to their customers. So I think what Health Entrepreneurs does from a technology point of view is using existing technology, but translating it into a context where it has not been used so far. And we are very successful. Because what we have been doing so far, we have in total more than 6,000 community health entrepreneurs onboarded. We are managing ourselves in our networks in Kenya, Uganda, Tanzania, and soon Burundi again. The networks ourselves, which include more than 5,000 entrepreneurs that are all offering those services, both providing basic health education, but also providing prescriptions and consultations for diseases where people, in case they don't go to our entrepreneur, need to travel for. Because that's our business case. We know that everyone living in a remote village will spend around $100 a year on basic health. Out of which, for the remote villages, more than 55% or $55 is on transport costs to acquire healthcare. And by just bringing this healthcare close to people, we are able to offer them a saving of around $55 a year, which is around 8% of their annual spending as a family. And so our intervention plays and offers services to the community where there is a need for, which are hard to access, and where we are able to improve access. At the same time, we offer a serious saving. And by using technology, we are using and able to use the expertise, the limited expertise of medical doctors and clinical officers, which are trained, which is very scarce and not properly scattered over the country because they all want to live in Kampala at the capital. And so we are using technology to make sure that their services are still available in the remote areas. This is my story. This is the story of healthy entrepreneurs. It's promising. It has a lot of potential, and we aim to grow the network from 5,000 today to 40,000 in the next 4 to 5 years, including replicating the model in multiple other countries. And technology plays a key role to keep our expenses low, but also to make sure that services are available, that were available for long in the remote areas in Australia and Canada, are now also available in remote villages. Thank you.
Thank you very much, Joost. I have a ton of questions, really interesting model. But I would love to invite Loic to share. Do we have a question from the audience regarding Joost's approach?
We have some comments emphasizing how great the idea is, but we don't have any questions yet.
No questions yet. That's good. So the questions will become coming. I would move on to the next speaker. We will have time for a conversation among us later on. So, Walpurga, are you ready to share your insights?
Yes, I'm ready. Good morning. So I would like to start my introduction with our why, our how, and our what, and will now share my screen. So do you see my screen?
Yes, we can see it.
Yes, okay. So I founded my organization at Tempo with my partner, Klaus, and our why was to change the role of people with disabilities from a needy fosterling to a needed expert. So how do we think that this change could become reality? We learned that easy comprehensible information, easy accessible knowledge, and easy manageable processes are the key for people with learning difficulties and disabilities to manage their own life independently. So what do we do since nearly 20 years? First, we do a lot. Therefore, I will pick out only one of our services and go from this point to our experiences so far with digitalization. This service we call Capito, and what we do is we reformulate complicated texts into easily understandable information that everybody can read and understand. And we do this as a social business. We have customers for this, and our customers are enterprises and NGOs and authorities, because they have recognized that poorly understood information leads to bad decisions and have negative impact for the persons as well as the companies itself and for our society. But our customers have also experienced that not only people with learning disabilities do not understand their information, but also a large proportion of their employees and customers do not. So we provide our services in Austria, Germany, and Switzerland within a network of about 30 social franchise partners. And together, we created jobs for more than 500 employees with disabilities. They work as experts for accessibility, as experts for understandability and usability, and as evaluators for service quality assessments. So why did we start with digitalization and when? We started 2016, and we started because we were very unhappy. Although we were sure that our services are really good and useful for our target groups, we saw that we would never be able to provide everybody's need for easy, comprehensible, and individually customized information in terms of complexity. Because traditional delivering processes for easy comprehensible information are designed in an analog logic, and they are designed out of the provider's perspective instead of the user's perspective. And this makes this information offers inflexible for the users. It makes the production time consuming and therefore expensive, and it allows only little upscaling. Our conclusion was it could become much better if we would use the potential of digitalization. So digitalization, from our point of view, is a process, and we do it in 3 steps, and we had many things to learn. First lesson we had to learn was, if you digitalize your services, you have to design them completely new. Don't think it would be a good idea to put your learning materials, for instance, which you used in the classroom face-to-face, just as they are in the net. It wouldn't work. So we had also to redesign our service, and we developed a new model for comprehensible information. It means that we provide one and the same information in at least 3, better 4 different language competence levels, from very easy to understand up to very complex. And this is precondition for our digitalization process, because based on this, users now can choose with our app their individually preferred language level on their own device. They can select their language competence level, and people who cannot read can use the read aloud function or can use the sign language videos. Lesson number 2 was, while some opinion leaders and decision makers in the companies and authorities experience an overload with several apps, our target groups and their pedagogical assistants often are merely digital illiterates. Even more, some social workers feel uncertain and rather reject the use of digital tools for their clients, although people with learning difficulties and disabilities are really interested in digitalization. But the COVID pandemic was on our side. Because there is so much of hardly to understand information concerning the COVID rules, many people began to use our news channel. And since the COVID pandemic, the usage rate grew up from 300,000 to nearly 600,000 active call documents in our app. The next step we have to do is to support those people who write information for the public or prepare lessons for education, for instance. And this support we do with a workbench, a digital workbench, which will analyze their text production in terms of comprehensibility, give them suggestions to improve, as well reformulate complex text automatically by using artificial intelligence. And in this phase, we learned that we have to develop every step in co-creation with our users. Otherwise, they wouldn't use it. The last step, and concurrent our vision, will be an automatically reformulation service for everybody, every time, and for every kind of text information. So if you think this wouldn't be possible because AI will not be able to do that, no. The AI is quite ready. AI will not be the barrier to this vision. The barrier is in our mind. As long as we believe that a smartphone would be a nice toy for digital nerds or a status symbol for people with money, and not a necessary tool to participate in society, like a car or a public transfer, as long we will exclude vulnerable target groups from digitalization. So what we need to overcome this gap between the potential of digitalization and the reality is a strategy which goes for digital infrastructure for everybody, digital education for everybody, and digital devices for everybody. And we have one lesson to learn overall, and this is digital inclusion is not a luxury, but an absolute necessity for participation of vulnerable groups in the 21st century. So I hope we can manage it. Thank you. for your attention.
Thank you, Walpurga. Again, thousands of questions, really interesting insights. Loic, do we have a question now, or is it?
In the meanwhile, we have one or two questions for you still. I think people are processing what Walpurga just said. So do you want to take the question for yours now or later?
Yeah, shoot, you can ask the question for yours so that
okay. So Joost, two questions so far in the chat. What have been or are your main challenges? And then are there any health issues based on a gender dimension?
Well, thank you very much for those questions. Challenges, there have been multiple. At the very beginning, when we started like 6-7 years ago using apps, there was an issue with the network coverage of 3G or 4G, which wasn't everywhere. So the first generation of apps were completely working offline. So there was no internet needed, and we only uploaded every 3 months the user data, knowing what and how the apps were used. I think Walpurga also referred to something that we also learned, that in the second and third generation of apps we have designed, the interaction with the user was key. So the number of assumptions we've made at the first step about how to use a smartphone, being a user of it, where the majority of our entrepreneurs were not users yet, made it well. We have learned a lot how to actually do so. So definitely we paid a price, and then we took time to learn, but at the same time that went in parallel with the way the whole model of health entrepreneurs has been designed. So it was definitely a barrier at the very beginning, but we were able to cope with it. And I think another lesson learned was we start using tablets where we moved to smartphones, because smartphones are way more, how do you say, multifunctional, and they can also facilitate payments. So the whole e-commerce component we have included in our model over time has actually, got into the model, and that's how we designed. So saying so, there have been barriers in limitation of the technology available, but technology keeps on moving, and we keep on moving together with the technology. So it's a process, we go kind of hand in hand. I think the second question was about gender. Can you just repeat the question, Loic?
Sure. The question was, are there any health issues based on a gender dimension?
Well, I think the majority of the health issues are women or child related. Is what we face, especially with populations with young populations, like 75% of the population is younger than 30 in Uganda. The majority of issues are related to maternal child health and to sexual and reproductive health. So those are key issues where mainly mothers and children coming in. That's also why we are having in our network more than 85% women being our entrepreneurs, providing the health services to their peers in the same gender. At the same time, they also have been considered as the entrepreneurs we are working with have also been selected by the community as trustworthy parties. We are offering their services, and in our team you will find both male and female responding to inquiries from our national team. But again, there also it's mainly women driven. I hope that answers the question.
Thank you, Joost. We have one or two questions for Walpurga also already in the chat, so I'll quickly take one or two of those. So there's a question, Walpurga, as an app builder, where do we start to ensure we reach all people through accessibility? Is one question, and there's another question around AI and how important is AI in your overall approach and solution?
Yeah, okay. So the first question, thank you for the questions. The first question was about accessibility in the app. So, okay, the app is a very fine solution for accessibility because you can provide every information really accessible for blind and for blind people, for people with impairments, and also for people who cannot read because of learning difficulties or disabilities. So it's always with digitalization, the digital tools have much more possibilities to provide information accessible. And so you have to know how to do it, and then it works. And the second question about AI is very interesting because AI is quite very, very important for our solution, because as I mentioned before, as long as we do the reformulation manually, so by humans, we will not be able to provide every need for easy to understand information. We are not able to provide it just in time, and we are not able to provide it in the mass which it is necessary. And AI now enables us to give reformulation just on demand and just in time, and we can scale up this solution very fast. So therefore, it is for us the logic step for improvement, and it is for us the most important step at the moment to improve our service for everybody.
Thanks, Walpurga. I think that's a great point, that scaling becomes a whole different thing in a digital world, which brings me to our third speaker, because Hugo, I think you have a lot to say about that, because he's in the meantime active in a lot of countries, as far as I know. So Hugo, we are looking forward to your insights, and please, the floor is yours.
Sure. Hey, hello, everyone. I just shared my screen, so just confirm that you can see it. Can you? All good? Yeah? Okay, good. So hello, everyone. I'm here representing Speak, which is an impact venture that works under the umbrella of social inclusion and integration of migrants and refugees. What we actually do is we try to connect newcomers and locals living in the same city with a high probability of creating relationships of support, loyalty, making sure that newcomers have a supportive network that is very efficient and effective, and that people are not in risk of social isolation. So that's what we do. We have like 3 key moments in terms of digitalization of transformation. I think the first one was like for people to understand operations-wise what we actually do. It's we organize people in language groups. So we use the motivation that people have to learn a language as a bait to actually put people together in informal spaces that are safe, offline, and we tap in a methodology through games and dynamics that increase the probability of creating those meaningful relationships. So it's pretty much offline. And in the beginning, everything in logistics was also offline. So people signed up through emails. We were putting like allocating people to different groups using Excel, communicating with phones. So not scalable. We were still trying to understand if this was working or not. And we started to see amazing success stories and people helping each other getting jobs, translating important documentation, taking people to healthcare, helping people to become citizens of the country. So we started to be super frustrated because there was like a huge bottleneck on scalability. And that was the first turning point. In which we basically started to create technology in order to automate or digitalize all the operations, so logistics. So we transformed Speak on an online to offline model that basically follows the same principles of like Uber and Airbnbs, where like logistics are actually online, but then the experience is offline. So here is the same. All the applications, the algorithm to match people, the algorithm to actually give the right information in the right time to the individuals was handled online, mostly in an automated way. But then the experience, the service of like connecting people, making sure that people could like learn with each other was offline. So that was the first key moment, and that allowed us to actually scale from 1 city to 10 and then 15 in our country, in Portugal, where we started. So this was the first one. Then the second one was when we started to understand that we had still a bottleneck to actually replicate and make this tool available for more people. And there what we did was tried to think of a growth model, and we ended up with something that is very close to a software as a service kind of approach. So basically, we transformed our technology to give granularity, allowing individuals to actually manage a speak city. So the idea was, if I'm in, let's say, like Madrid or Rome or whatever, and I want to implement speak and help connecting people in my city, make the process very easy for me to open a city and like manage my city through like a web platform that is very nice and easy to use, and still have all the bonus of making sure that people are trained in the same way, the values are there, that there's still a impact assessment that is standard for everyone, that the methodology is there. So we basically transformed Speak on a software as a service kind of, and that allowed us to, for example, in 2019, opening 20 cities outside Portugal in less than 12 months with this model. So today we are in 12 countries. And that was like another extra point on digitalizing the service. But it was still about the operations, because our model was like, we will always do this offline, because what we want is to connect people offline, and everyone is going online. And for us, it's super important that we actually push people to the offline as soon as possible. So in different conferences, I always said we are not going online until we had to go, because in February this year, and this brings us to the third point, we started closing operations in Italy first in February, and like after a couple of weeks or 3 weeks, all our cities were closed due to COVID-19. And that's when we actually had to change the model and actually move to the online. And that was a huge change, because like, organizing groups offline and online is totally different. The methodology is totally different. The attention span is totally different. Connection issues, and also some people that use Speak from vulnerable groups, they don't have, it's like access to the technology is true, but not for everyone. And so that was an extra challenge for us. So today, I think like we have 4 main differentiators. We include technology as one, because I think we did very well there. The experience is community-based. The learning is not an end on its own, so we use it as a bait to achieve a different end. And the participants are the change makers, as I saw on the first presentation. Is pretty. We follow more or less the same model. So we try to empower people to actually, and they own the solution. So we are completely outside of the operation on the field. The strongest statement that we use is that Speak breaks down the social isolation barrier in 12 weeks. We have been trying to decrease these, and we achieved these in 12 weeks now. Like these are numbers from this year, so only 2020, for you to have an idea, we have almost 3,000 language groups, 46 language, 160 nationalities using, and more than 500 refugees using Speak. It's very difficult to track who is a refugee, because we don't ask for data. So these are the ones that we know that they are for sure, because we partner up with organizations that actually are helping them with autonomy and empowerment. So that's how we flag them. But we have more. But this is for sure because they are flagged that way. Here are some impact numbers. I'll leave this for Q&A if we have time. And here are like 5 things we learned with these 3, the last challenge of digitalization. Not all are related with digitalization, but I think the characteristics are. And these are the 5 things we learned since February. So the first one is like, you better move fast and be comfortable in making decisions with limited information. So that was, and like this was true for COVID, but I think this is true like for almost everything. And that allowed us to actually like be able to create a solution, not knowing very well if it will be effective and efficient and will work, but it allowed us to make progress. The second one is that a strong and aligned team makes things fast and look easy. So I think that was super important. We have a pretty small team for the community we have. We have a centralized team of 12 people. And then, of course, we have all the founders. Used to call them entrepreneurs, we call them founders, but it's more or less the same thing. And those, like, we have more than 30 around those countries. And when people are super aligned and we know what we are here for, magic can happen, and it's super important to have that alignment in the team. The third one is leverage the opportunity and be okay that we cannot help everyone. Of course, the value proposition of Speak is connecting people offline and making sure that people have access to a network where they are living. But since we were going global, it didn't actually make sense to have we were not able to connect people in the same city. So we tried to, okay, since we are global, let's try to make this available for everyone everywhere. And so let's make sure that all organizations that are working with refugees can use Speak for free during this moment. And this increased our numbers like crazy. So we had people from countries that we never served using Speak with amazing stories like LGBT, refugees, organizations in countries and places that we didn't know that existed. Like countries like Bangladesh, Syria, and Greece that we are not there yet, but they were able to use and leverage the opportunity. So it was true that some people that we were serving, we couldn't serve anymore because they didn't have access to technology. But like we didn't have time to handle that part. But since we were like global, let's at least try to increase the audience and make sure that we can multiply the number of people benefiting from our solution. And so this is the one about leveraging opportunity. And then this one that brought us loads of frustration is that technology is not true for everyone. So there are some vulnerable groups and some individuals that have limited access to technology. And that is super frustrating because to solve a problem like that, you need time. And so if offline closes from one day to the other, like we didn't have time to make sure that technology was accessible, that we had programs to empower people and make everyone tech savvy. So now for us it's super important, and now we understand why like organizations like Facebook, Amazon, and so on are trying to connect everyone and democratize the access to the technology. Like it's super important and I think COVID make this even more clear. And yeah, so I'll stop here in favor of time, but very happy to handle other questions that you might have on the Q&A.
Thank you very much, Hugo. So we would now move into a discussion on where to move from here. Also, the participants are invited to participate. I'm quickly going to share quickly my screen. So we already have some insights already on barriers, enablers in this conversation. And now we also, of course, think of ideas moving forward. So what is needed that we can actually improve the inclusion of vulnerable groups, disadvantaged groups. And the first question that I want to pose to the plenum, to the plenary, is you've already said that all of you say that through digitalization there is a massive potential in scaling. So you have the potential to really reach a lot more people. From my experience, at least in Austria, I saw that sometimes you reach those people, but the way they use the services is a different story, and you often lead offline facilitation, offline work to actually make sure the services are used not only the right way, but also so that they help those communities. What are your thoughts on that? Whoever wants to go first goes first.
Well, let me respond first. I definitely believe in case of rural Africa technology is an enabler, but it definitely doesn't go on its own in the context we are operating in. So when I hear Hugo talking about the potential of the platform and almost see similarities with Facebook and other platforms that can grow very fast. In our case, technology is part of a service provision, but still we need to also have humans in there. I think even for scaling, artificial intelligence partly comes in our training parts, and a number of questions might be responded in future automatically where there's no experts needed. So there's optimization needed, but still providing healthcare in many cases, wherever you are, it has something to do with people, and actually a number of questions need to be raised. And well, that's what we've experienced so far. At the same time, our final patients or customers are not able to use those sophisticated solutions. So we need to have those people that are actually bridging the distance and actually bridging the gap between the most vulnerable ones and our solution. And that's where our entrepreneurs comes in. That still requires a lot of training. So also it's true that it takes a couple of days before they start using their phones proper. We use all the training we provide, we use the phone as the base. So they start using and work for 5 days in a row, continuously using the phone. So that already makes them much more convenient. And we are very happy that these days Facebook and other solutions are also being more and more used throughout. If you take the smartphone penetration, you realize also in the African continent, it's growing and continues going fast. So more and more people are using it. So there's a lot of potential, but yes, definitely in service provision, including the physical supply chain, it all remains an enabler for now. And even for scaling and replicating, although we are ambitious, we still need also to train and continue training our people to actually use it properly.
Thank you. Hugo, Walpurga, your other thoughts on that?
I'm super sorry, I was changing Wi-Fi connection and I didn't hear the question.
The question was, scaling through digital means is a topic in all three of you. And I wonder, how do you make sure that not only the person gets this app or whatever digital device it's using on her phone, it's also how will they use it in a way that actually benefits them in the way it's supposed to be. So make sure that it just only scale in the digital without making sure people are using the technology in the right way.
Yeah, super challenging question. In our way, like what we are trying to do is discovering. So we have studies and research and metrics to track how people are using the technology, and we are still very close because we are not big, we are not mainstream at all. So it's still possible to really be on the field and try to understand where we should go next. We are just like very careful, and I think there's loads of like I have a bazillion questions to use because like we have a bazillion problems with legal in the countries that we are trying to scale, with payment methods, making sure that like what data you are allowed to take from the user in each country is different. So we are still like learning a lot and moving carefully with that.
Cool, thanks a lot. Loic, do we have any questions from the audience?
Well, we have some reactions and some specific questions.
Wait a second. Just sorry, I saw Walpurga raising her hand. Walpurga, you want to go first? And you collect the question.
I would like to add something. How do we solve that our solution is really used by the people or is really needed by the people? So I think one of our accounting is we do not count the downloads of the app as many startups do, and also buy some downloads or something else. So we count, as I mentioned before, how often people actively ask for the documents to read, and we look which documents and which kind of information do they read. And therefore we see which kind of information is really important for them and can also improve quality of this kind of information and also the scale. So this is one point. I think it's our that we do some information or some services like Yoast or Hugo, which are really needed, yeah, and not bullshit. So we use digitalization for needed things. And the other thing I think it's important is that the digitalization allows us to use humans' quality exactly for that tasks where humans' quality is really needed and important, and not for those tasks which AI or digitalization can manage much more better. For example, in Austria, personal assistance for disabled people is managed often only in an analog logic. So if you look for a personal assistant, you have to call a service provider in the office time, so between 8 and 4 p.m., and you have to ask them, and then they are going to search for some assistance, and then they send it to you, and so on. So you see, it's a very analog logic, and it's very so it's not very fast, yeah, and it's not very individually. And we designed a digital platform, like a marketplace, to find assistance persons and to match and to organize all these processes you need to organize personal assistance and document it. And now people can use this quality of digitalization, which means it's much more flexible. You can use it on midnight if you want. You can use it on Friday evening and also look for a personal assistant when service provider staff is sitting at home. Yeah, so you can do much more with digitalization. And can use the human task or the human quality for other things, for advice, for networking, for things where really humans are important, and not for the things which digital tools can do much better.
Thanks, Walpurga. We collect quotes. For instance, don't do services that are bullshit. It would be a great quote. Let's see if we put it on a slide. Loic, we have time for one question.
There's a question around how do public actors react to this? And we can perhaps expand a bit the question and kind of ask some of the panelists to comment on which type of framework conditions are necessary looking forward to further develop this, and which role do you see from public actors? Is it an enabler, a barrier? And what's your experience with public actors so far?
So whoever wants to go, please.
You mean in incentives for digitalization, for example? So in Portugal, it's not that good because unfortunately, most of finance instruments that are available from the public actors have a no-go into things that are key. One is technology and the other is human resources. So, so it's super challenging to make things happen with those rules. I think things are changing, especially now, because we needed a pandemic like this for people to open calls for technology development and make software available and create software that works. So we are trying to leverage that opportunity now and try to get some help to sponsor our roadmap tech-wise. So this is something. But in the other hand, I think in Portugal, that's like, we are in different countries, but I know better how we do it in Portugal. In the other hand, like the pandemic kind of opened a little bit, or made the relationship with public actors way more easy, because they were looking for solutions, and that allowed us, for example, like Speak is used by, it's the only private solution used in Portugal to help on the integration of refugees, for example. In Spain, we always try to help, and it was always very difficult, but it seems that all the solutions that the Spanish foundations and organizations to support refugees didn't have a solution for the language, for example, and they had to work with us because they didn't have other solution, and we were the ones that were able to actually move a little bit faster and bringing a solution that, of course, was not perfect, but was something during the confinement period. So I think agility kind of gave us opportunity, and I think public actors are, pandemia made the communication easier, and also it was an eye opener for technology. Yeah.
Thanks, Hugo. We have time for one more statement.
Yeah, if I'm allowed, I would like.
Sure, go ahead.
Thank you. As I mentioned before, that pedagogical staff and social workers could not be called as the first movers in terms of technology. I think it's the same with officials from local authorities. So we experience them as a very uncertain and very, very slow. By understanding the potential of digitalization, it's really a pity, because they are really a big barrier to implement digital services and tools. On the other side, we have in Austria very interested research funding agencies, and here are the enablers. Also here the ecosystem for social entrepreneurship and for research. This is our enabling ecosystem in Austria. But it's really a pity, all those people who would be in charge of bringing the things on the earth and implement them last movers. So it's really a pity.
Okay, thanks, Walpurga. We're coming to the end of the session, and I want to make one last closing round. And at the same time, I also invite, so I'm posting the Mentimeter again. And there is my question to the audience. What are your ideas moving forward? And also, this is the question to my plenary, and I invite you to make it short because we have 2 minutes left. So what are ideas that we should continue in times like these? And I invite Joost to start, please.
Okay, well, thank you very much. What we need to continue doing is to continue using technology to reach scale. When we talk about the environment we are operating in 2030, we expect more than 1 billion people who are lacking access to healthcare. And so it's a journey we are at. There is no governmental guidelines yet. There is no policy making for telehealth on the African continent yet. There's some WHO support that gives some guidelines, but it's all very early stage. At the same time, technology goes. So regarding policymakers, well, I think they will be kept a long time behind where we are, but we need to continue testing, keeping the ethical practice in place, trying to stick to as much as possible national guidelines, which are different in each country, but technology fits in and is the way forward to actually sort out a big issue globally, at least to our understanding, to make sure that vulnerable communities are actually properly served and reached. And so it's a process, it's combining existing technology, it's learning from each other. And I think the Western world, but also the African or developing world is actually going here hand in hand. And sometimes we are more advanced than what's happening in the Western world. But it's an onward journey, and I wish to join and do this together.
Thank you, Joost. Walpurga.
So I was happy about the statement of Hugo, leverage the opportunity, because I think that's what we need from everybody, and we need people who are interested in it, and we need that people understand that digitalization and digital tools are not a toy. Because
Very good, thank you. And Hugo, really short, what is your takeaway?
Yeah, I like one is that technology, of course, can give us scalability, and that's key, because we are all here for the same. It scale our impact. And the second thing is that we are not there yet, but I think once we control technology in a nice way in our teams, we can actually a little bit easier tap unmet needs. So if we see the winners on the traditional world, what they do is that they compete for every dollar, so they tap very easy and quick for unmet needs. And we, on the impact side, we are usually to be super focused, and we can't do much more. But we are not there yet. But once we control technology, we might be able to tap unmet needs and increase the impact and the added value for the people we work with.
Fantastic. Thank you, Hugo. Thank you, Walpurga. Thank you, Joost. And thank you, Loic. I will share one last time my screen, so you can still put in all your ideas moving forward. Thank you for participating, and looking forward to connect with all of you in the rest of the summit. So thanks again, and goodbye.